He's about 6 months old. I started noticing that he wasn't hitting milestones. And it was about a year after that he was given the cerebral palsy diagnosis. For most of Leo's life, Medicaid covered probably 75% of services. If the Republican health care bill passed, he would potentially lose access to his speech therapy, to his neurologists, to his ophthalmologists, pediatrics. If this legislation were the law, we would be facing an increase in premiums. Making insurance unaffordable is the same thing as denying people access to insurance, right? Trump said that people would not be excluded because of pre-existing conditions, but making healthcare unaffordable is excluding people. When I hear about what other families are facing, whether it is things like medication or surgeries, things that they depend on to literally keep their children alive, that they would lose access to if this legislation passed, it's really devastating. No one should have to choose between paying rent and paying for insurance. It's just not right. Leo was born with cerebral palsy, and defining him by that and limiting his access to the healthcare that he needs because of the way that he was born is like the purest form of discrimination in my mind. It is basically saying that there's something wrong with the way that he was born or that he's flawed in some way. He's not. He's amazing.
I'm not a baby anymore.
And you're not a baby anymore. That's true. And cerebral palsy is a part of who he is, and he shouldn't be penalized for that. People watching this, please protect people like Leo and I, and ask your senators to vote no on the Affordable Care Act repeal.
Ladies and gentlemen, please welcome to the stage Ben Wickler and Karine Jean-Pierre from MoveOn.org.
Hello, I'm Ben Wickler.
And I'm Karine Jean-Pierre.
In less than a week, the United States Senate will vote on one of the deadliest, most greed-fueled, most fundamentally unjust pieces of legislation in American history. This is not a drill. This bill is on the knife's edge. This is code red, because the only thing standing between the American people and this bill is you. And that's why today we are bringing the Don't Take Away Our Healthcare tour to the biggest city in the most important political battleground state in the United States, where the resistance movement is on fire, where you are ready to battle, to ask you one question. Are you ready to fight?
Columbus, Ohio! Thank you so much for being here. I want to make sure that we thank our co-sponsors, Progress Ohio and SEIU. Let's hear it for them. I know there's some VIPs in the house that I want to make sure we acknowledge as well. Former Rep. Betty Sutton and then former Rep. Mayor Mary Jo Kilroy. And also, are there some doctors in the house? We got our lab coat doctors with us as well today.
Listen, man, Sherrod Brown is fighting against this terrible bill. Let's give it up for Sherrod Brown. Here's the real question. Where's Portman?
That's right. Where is Portman?
This guy helped write this bill. Let's take a second. What is in this bill? Why are we here to fight against Trumpcare?
That's That's right.
Let's just review. There are 3 things that everyone in this country needs to know about this bill, and they don't know them yet. So it is our job to spread the word until no one has any doubt about what this monstrosity is. The first thing at the heart of this bill is a giant, giant slashing cut to Medicaid. The House bill would cut Medicaid by $834 billion, billion with a B. And the Senate bill, the one Rob Portman helped write, is worse. If you slash Medicaid, not only are you kicking millions of people off their health care, not only do you end the Medicaid expansion and cut the fundamental way the program works, you end Medicaid as we know it, not only does that eliminate health care for people, 2/3 of people in nursing homes are supported by Medicaid right now. 1/3 of all Medicaid funds go to people with disabilities. You are hurting the people who need it most. And if you cut Medicaid, that means that every state budget suddenly has a giant hole, which means suddenly schools have class sizes that are growing and teachers getting laid off. Road construction is halted. Jobs are lost. This affects every single thing that happens in a state. Anyone here live in a state in the United States of America? This affects all of us. So it's a giant cut to Medicaid. Second thing it does, makes healthcare unaffordable so much that people can't afford to buy it. This is supposed to be their way of reducing premiums. That's what they keep talking about. It'll cut premiums. You know what happens to premiums? They go up. Which way do premiums go in the Republican healthcare bill? Up. Where's this bill going? Down. This bill would allow insurance companies to charge older people 5 times as much as younger people. And then it would cut the supports to help them pay for their premiums. When you do that, people can't afford insurance. The House bill would kick 23 million people off their insurance. There's no doubt that the Senate bill will kick tens of millions of Americans off their insurance. Are we going to let that happen? No! They work for us. 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 So why are they doing all this? There is one reason. Greed. This is a tax cut for the wealthy on a giant scale. The average tax cut for someone earning $200,000 a year or less, $0. The average tax cut for someone in the top 400 families in America, $7 million a year. So what are we going to do, folks? Are we going to stand back or are we going to fight? When Medicaid is under attack, what do? Stand up, fight back. When Medicaid is under attack, what do? Stand up, fight back. When health care is under attack, what do? Stand up, fight back. When the ACA is under attack, what do? Stand up, fight back. I think we're going to stand up and fight back.
I think that's right.
I think that sounds like a good plan.
I
I think we're all on the same page here.
This coming week, as Ben was mentioning, they are going to try to pass a cruel bill. It's cruel. And Rob Portman, I quote, said this week, "If the final legislation is good for Ohio, I will support it. If not, I will oppose it." Let's send Rob Portman a message, Columbus, Ohio. They think we are weak. They think we are divided. They think that our resistance is temporary. It's up to us, Columbus, Ohio, to prove them wrong. It's up to us to show them that we have our values, and they can't take it away. Columbus, we need you more now than ever. Are you ready? Let's send a message to Washington, D.C. Let's give them our voices. Let's be loud and clear. Protect our care. We are not going to take this cruel bill.
This is going to be a crazy week in politics. This is the week when Mitch McConnell is going to start introducing these little amendments that make the bill look a tiny, tiny bit less vicious. And Republican senators are going to say, oh, everything's fixed. This is great. We can vote for it. Are we going to let them get away with that? No! Are we going to let them get away with that? No! Do you think we're going to let them get away with that?
Hell no!
No. So listen, I want you to take out your phone right now. Your phone is your friend this week. Apologize to your children, apologize to your parents. You need to have your phone on you at all times. I want you to take it out and type in the number 787-753. No, that's not the number. I'm going to give you a different number. 668-366. That's the number. 668-366, and then text the word care to that number. Okay, what's the number? 668-366. 668-366. 668-366. And the word is care. Send it. You will get a response. There might be a little lag because never this many people have texted it at the same time. But this will give you alerts. This will tell you when it is time to call your senator, when it's time to call Rob Portman. We need to be on our feet this week because this is going to move fast, and this bill, honestly, no one in Washington knows what's going to happen. It could live or die this week, and there is no vote more pivotal or key than Rob Portman. He needs to get an absolutely loud, thunderous, clear message. If he votes against it, there's no way it's going to pass. If he votes for it, we might still beat it, but it definitely could pass. So, has everyone texted? Raise your hand if you texted. Yes, I love those hands. Give yourselves a round of applause.
All right, Columbus, we have some great speakers for you today that's going to tell you their story. Yes, we do have Bernie. He's coming. He's coming. We want to hear some real stories from people who are really affected by what's about to happen this week. So I'm going to just introduce them and give you a little bio on them. Dr. Matthew Norsday Jones, a primary care doctor at a community health center in Dayton, Ohio. He's here. Pastor Jason Ridley, he's going to speak about how the members of his congregation really benefit from ACA. And then we have Rian Childs, a student and former Planned Parenthood patient. First up is Dr. Norsday Jones. Thanks, everybody.
Let's give it up. Thank you.
You guys are amazing. Thank you so much for being here. My name's Dr. NJ. I'm super excited. I'm also kind of tired. This has been a harrowing 5 months, and yes, it has actually only been 5 months so far. But together, we have done so much. You guys being at places like this, at rallies, calling your representatives, that's what slowed this bill down. It's the only reason we don't already have this healthcare reform. You've given hope to those of us who take care of patients every single day. You've given hope to those of us who have pre-existing conditions. I have type 1 diabetes. This affects me very personally. And you've given hope to those of us with family members that rely on Medicaid for their long-term care or for anything else. So I'm a primary doctor in Dayton. As they mentioned, I work for a community health center, which means that I take care of anybody who comes in the door, regardless of whether they have insurance or not. And I can tell you from firsthand experience that this will affect everyone in Ohio, that this affects our patients, that this affects our health centers, that this will be a disaster. Since the implementation of Obamacare, 700,000 people in Ohio have been able to benefit from the Medicaid expansion. In our offices, we've seen the uninsured rate go from 40% down to less than 5%. And I can't tell you how important that is for both our patients and our medical centers alike. We are able to do more for our patients who were then just working desperately to get the most basic of care. Our patients are able to take care of their health without worrying that they're going to go bankrupt because of the bills. And remember that the Medicaid expansion, many of the people who qualified that I see every day, these are hardworking Ohioans who work 2 or 3 part-time jobs that don't offer health insurance. They are just barely getting by. Without health insurance, they're forced to continue to work as hard as they can until their medical problems become too bad and they just can't work anymore. And then they finally have to quit and start taking care of their problems in a way that is way too late and way too expensive for them. But this isn't a problem anymore. One of the things that I want to talk about is the opioid epidemic. As all of you know, it's a disaster in Ohio, especially in Dayton, where I come from. This has been horrible. But current funding for Medicaid and the requirement that insurance companies cover mental health and addiction treatment is what has allowed us to finally start fighting this, and we need to keep it that way. I just saw a patient of mine earlier this week, actually, she's a mother who is battling with addiction for years and years, not able to take care of her kids who had to go into foster care. She has been able to get medication-assisted treatment, one of the things that has been shown to help people really fight these opioid epidemics. She is now back on her feet. She's working again. She's taking care of her kids. She's able to have that life that she dreamed of. If this bill passes, we won't be able to keep the clinics open. We won't be able to keep that medication-assisted therapy that we need, and it will have a devastating effect. I see parents all the time whose kids have died because of overdoses, and I can think of nothing more devastating, and that is going to get more common if we let this bill go through. Exactly. We also need to remember that these changes in Medicaid don't just affect those people on the Medicaid expansion. Medicaid already covered children, people with disabilities, and seniors in nursing homes prior to the expansion, and all of these people will be affected. Half the births in Ohio are covered by Medicaid right now. This means that mothers are able to actually get their prenatal care so that their babies can start out healthy lives. This bill will effectively take apart Medicaid. It will also allow private insurances to stop covering maternity care in their policies, which is something that happened a lot before the ACA. This doesn't mean that we don't need that care anymore. It just means that people won't get it. It means that women will have more problems during their pregnancy and that babies will be born sicker or die. On the other end of the spectrum in life, what people don't remember, or what was mentioned a little bit earlier but people often forget, is that 2/3 of older people in nursing homes are covered by Medicaid, not Medicare. Our loved ones who require long-term care either in nursing home or at home are affected by this. My family is personally affected by this. My mother-in-law is someone who requires long-term care because of a stroke, and she requires Medicaid to help take care of her every day and to allow her to stay in her home. I have many individual stories. I have a lot of numbers, but that's not really the important thing. What we have to remember today is that people are going to die and people are going to be sicker if we let this pass. One last thing is the economic side of this for our community health centers. Like I mentioned before, this has been a lifesaver. We're a small business in Dayton. We've been able to expand. We've been able to employ more people because we get more insured patients, and we can get more health care to those patients because of this. This is something that's multiplied across the state throughout community health centers, through hospitals, especially rural hospitals, who need these funds to stay alive and to stay there. Medicaid is both a lifesaver for our people and for our Ohio communities. So there are still problems with health care in this country, and there's almost no one who won't say we can't do better. But is this really the health reform that they think we need? Exactly. This bill was created in secret. It was sped through Congress for a good reason. As President Trump said about the House bill, this bill is just mean. What we really need in Ohio and across the nation is health care that allows us to be healthy at whatever age we are in life and whatever we're doing in life. We need health care that is able to cover our medications, that's able to cover the care that we need, whatever is going on in our life, because we don't make choices to do things like have cancer or to have diabetes. Exactly. We need health care that is responsive to our concerns and our democracy. We need health care for all Ohioans. Thank you guys so much. Keep up the great work. Call your senators, email them, stop by their offices. Make sure they know that we're here and we're not going away. Thank you again.
Ladies and gentlemen, welcome to the stage, Pastor Jason Ridley.
Are you ready to fight, Ohio? I have something I want to say. There is nothing American about the American Health Care Act. It is an immoral and irredeemable bill, slashing Medicaid and taking health insurance away from millions of low-income Americans, people with disabilities, children and seniors, while lavishing tax cuts on insurance companies and the very wealthy is a grave sin and a health care emergency. Now, we live in the great state of Ohio, but we have some challenges here. Last year, we led the nation in opiate overdose deaths, and we are on our way to unfortunately leading the nation again this year. Already in this city of Columbus, we have a 66% increase in opiate overdose deaths this year compared to where we were at this time last year. As pastor of the Hilltop Community Worship Center, I've seen firsthand the devastating impact that drug addiction has had on our community. I think of a young man named Eddie who joined my church because he wanted to change his life. I personally gave him Bible studies, and I'll never forget the day. It was a Thursday morning, 2 days before his baptism, and we had just finished one of our last lessons. Eddie was so happy. He even talked to me that morning about wanting to marry his fiancée soon. But later that same day, his fiancée was found dead in an alley from a heroin overdose, and Eddie's life has never been the same. I think of a young man named James who came from the community and joined my church because he wanted a fresh start in life, but before he could begin, 7 days later, he was found dead on his porch from a heroin overdose. Senator Portman, I implore you to stand by your words, where you acknowledge that there is an opiate crisis in this country and that you would not support a bill such as the American Health Care Act, which does not do enough to protect Ohio's Medicaid expansion population, especially those who are receiving treatment from heroin and prescription drug abuse. Speaking to the Medical Committee for Human Rights, the late great civil rights leader Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." I call on you to stand by your words today as we Ohioans continue to stand together and denounce this immoral health bill, which is both shocking and inhumane and will take away health care insurance from 1 million Ohioans. But I stand in support of the Affordable Care Act, which, unlike this current bill, wasn't done in secrecy. When the Affordable Care Act passed into law, the bill had been online for 3 months. There were 200 bipartisan hearings and meetings. It was the longest markup in decades, going on for 7 days, and it was on the Senate floor for 25 days. But I support the Affordable Care Act, which falls in line with the great principles of the Christian faith that I hold so dearly, where Jesus Christ himself said, "I have come that they might have life and that they might have it more abundantly." The Affordable Care Act has enabled Americans to have life and have it more abundantly, because Americans are no longer declared uninsurable because of pre-existing conditions. Americans are no longer declared uninsurable because of their age. Americans are no longer declared uninsurable because of lack of financial resources. And Americans are no longer declared uninsurable because of lack of employment. And Americans are no longer declared uninsurable because of mental illness and addiction. A New England Journal of Medicine study indicates that without the Affordable Care Act, 40,000 more people will die annually. People will literally die if this new health bill is passed, and that ain't right. We stand and fight against this death bill today, and senators, our eyes are upon you, and we expect you to stand with us in denouncing this death bill. The book of Isaiah in the scriptures, which many of our congressmen profess of faith and believe in, is very clear about our lawmakers' moral duty. It says, "Woe unto you who make unjust laws, to those who issue oppressive decrees, to deprive the poor of their rights and withhold justice from the oppressed of my people, making widows their prey and robbing the fatherless." This health care bill is an unjust law. This is one issue where you cannot, in good conscience, vote the party line over the issue of the people. From polls to town hall meetings all across this nation have overwhelmingly rejected repealing the Affordable Care Act. We must keep fighting.
Ladies and gentlemen, please welcome Rhiannon Childs.
Boy, that's a hard act to follow. Hello, everyone. My name is Rhiannon Childs, and I am here today because I support Planned Parenthood. I stand with Planned Parenthood because Planned Parenthood was there for me. Planned Parenthood has serviced 2.5 million patients in the U.S. this year, including our nation's veterans. Between 2013 and 2015, there has been a 42% drop in uninsured veterans under the ACA. A veteran myself, I know all too well how terrifying and dangerous this is to return home from service to reintegrate into civilian life with no health care. Veterans serve our country, often at a great personal cost, and we deserve health care. Planned Parenthood knows this and is determined to protect the U.S. veterans' health care just as veterans protect the U.S. at home and abroad. In Ohio alone, Planned Parenthood has helped 81,767 patients, comprising 156,009 visits in 2016. 41% paid with Medicaid. The Senate health care bill drafted, aka Trumpcare, will strip thousands of Ohioans from Planned Parenthood Health Center services that offer birth control, HIV testing, counseling, men's health services, pregnancy testing, STI testing, treatment, and vaccines. The Senate bill was drafted by 13 men behind closed doors, excluding women from the table and lack protection of gender-based healthcare cost inflation. This bill is the worst bill for women in a generation. And this bill would defund Planned Parenthood by blocking Medicaid coverage from accessing preventative care at Planned Parenthood health centers. In addition to defunding Planned Parenthood and slashing Medicaid, it guts essential benefits protections including maternity coverage and prescription drugs. 13 million women could lose coverage to maternity care under this bill. We women are not a pre-existing condition, and I reject that notion. This bill would disproportionately impact women who already face unfair barriers to care, including low-income women and women of color. Ohio ranks second in the nation for Black infant deaths. Infant mortality rates in Ohio are more than 2 times the national average. Ohio is one of 2 states in the nation that doesn't offer sex education in public schools. In 8 counties, Planned Parenthood is the only provider of full services for birth control, and in 22% of Ohio counties, Planned Parenthood serves the majority of patients receiving publicly funded family planning. This is not a drill. Planned Parenthood calls on you to take a stand. Contact your local senators and demand that they kill the bill. Thank you, and thank you for standing with Planned Parenthood.
Ladies and gentlemen, Ben Wickler and Karine Jean-Pierre of MoveOn.org.
Let's hear it for all of our great speakers today.
Columbus, Ohio, are you ready to fight? Let's give it up for today's guest of honor, U.S. Senator Bernie Sanders!
Thank you, Columbus. This is a wonderful, wonderful turnout, and let me just thank all of you for being here this morning, and most importantly, not just being here, but having the courage to stand up for justice, to stand up for dignity. Let me also thank you for standing up for democracy and demanding a government that represents all of us, not just the 1%. Let me thank MoveOn.org and SEIU Local 1199 and Progress Ohio for sponsoring this event. And let me thank those who have already spoken. As Harry Truman said, we're just going to tell the truth. That's hell enough for them. Now, I understand, I know and you know that during his campaign for the presidency, Donald Trump told the people of Ohio, he told the people of Vermont, he told the people of this country that he was going to be the champion of the working class. Remember that? That he, Donald Trump, was going to stand up for those who were in pain, for those who were struggling, and he was going to take on special interests. Well, I am sorry to have to tell you what you already know. He was not telling the truth. The so-called health care bill passed in the House last month, strongly supported by President Trump, is the most anti-working class legislation ever passed in the modern history of our country, and the Senate bill, in many respects, is even worse. At a time when families in Ohio, in Vermont, and throughout this country are struggling to keep their heads above water, they're struggling to put food on the table, to put a few bucks away for their kids' college education. At a time when so many people are hurting, this legislation will cause devastating pain to millions of American families. Now, we are gathered here this morning to make one simple point. And what we are saying as loudly as we can, and I've heard you, you are pretty loud. And what we are saying is that we will not allow 23 million Americans to be thrown off of the health insurance they currently have in order to give $500 billion in tax breaks to the wealthiest 2%, to the insurance companies, and to the drug companies. The truth is that this so-called health care bill is nothing more than a massive transfer of wealth from working families to the very, very rich. While this bill calls for massive cuts to Medicaid, calls for seniors in Ohio and all over this country to be paying far, far more for their premiums, calls for the defunding of Planned Parenthood. At the same time, this legislation would allow the 400 highest income taxpayers, 400 people, most of them billionaires, to receive $33 billion in tax cuts. Now, that is not what America is about. That's not what our moral values are about. We don't take from struggling working class families. We don't take from disabled children. We don't take from the elderly. We don't take from the sick in order to give huge tax breaks to billionaires. And let me say to my colleague, Rob Portman, Rob, this is an immoral piece of legislation. And I say to Senator Portman, join your fellow Ohio Senator Sherrod Brown and please, join Sherrod Brown and please vote no on this horrific piece of legislation. If Senator Portman votes no, the strong likelihood is this bill will go down. And I say to Senator Portman, if you don't believe what I am saying about this legislation, listen to your own governor, John Kasich, a fellow Republican. Now, Governor Kasich and I have known each other for a very long time. We served in the House together, and we disagree on almost every issue. That will be no surprise to you. But on this issue, I must say that the governor is absolutely right when he said the other day, this is what Governor Kasich said, quote, I have deep concerns with the details of the U.S. Senate's plan to fix America's healthcare system and the resources needed to help our most vulnerable, including those who are dealing with drug addiction, mental illness, and chronic health problems and have nowhere else to turn, end quote. Governor Kasich is right. Senator Portman, listen to your governor. Now, last month, as you know, by a two-vote margin, 2 votes, the House passed a disastrous bill, and the Senate bill, which is very similar, will come up likely for a vote this very week. And this is what the Republican House bill does. Let me just go through some of what it actually does. Today in America, we have 28 million people today, before the Republican bill, 28 million people have no health insurance at all, and millions more are underinsured with high deductibles and high copayments, including many of you. And while 28 million people are uninsured, this bill will throw an additional 23 million people off of the health care they have, raising the total of uninsured in America to over 50 million people. This is literally beyond comprehension. It is unconscionable, and it must not be allowed to happen. Now, everyone here knows, there's no great secret that the Affordable Care Act is far from perfect. Our job now is to improve it, not destroy it. Our job is to lower deductibles, lower copayments, lower premiums, not to throw 23 million people off of health insurance. Further, after we defeat this disastrous Republican proposal, our job, and we need all of your help to make this happen, our job is to have the United States of America, our great nation, join every other major country on earth in guaranteeing health care to all people as a right, not a privilege. Now, you know, it's a funny thing. In our great country, the wealthiest country in the history of the world, we look around us. I live 50 miles away from Canada. They manage to provide health care to all their people. Go to Germany, go to the UK, go to Scandinavia, go to France. Every major country understands that in a civilized society, health care must be a right for all people, not just the rich. So our job in the coming months after we defeat this legislation is to take on the insurance companies who rip us off every day. To take on the drug companies who charge us the highest prices in the world for the medicine we need. And our job is to go forward and pass a Medicare for all single-payer program. If every other major country on earth could do it, surely this great country can do it as well. Now, all over this country today, in Ohio, in my state of Vermont, all over this country, there is enormous anxiety because people today on Medicaid, people today on health insurance, they are wondering what will happen to their lives, what will happen to their parents' lives, what will happen to their children if suddenly health care is taken away from them. What does it mean? And I want you to think about it for a moment. Put yourself into somebody else's place. What does it mean today if you are struggling for your life, dealing with cancer, dealing with heart disease, dealing with diabetes, dealing with some other chronic illness that is threatening your existence? What does it mean when you read in the paper that Republicans may take away your health insurance? Now, what happens to you when you cannot afford to go to a doctor. What happens if you are sick today? You're really sick, some chronic disease, and you cannot afford to go to the doctor or buy the medicine that you need. And the horrible, and we have to deal with it. I've been criticized for saying this, but I will say it again because it's important that we say it. And I say this not for political reasons, not to be overly dramatic, but the facts are clear. And it's not just me. It's the Harvard School of Public Health. It is doctors all over this country who study the issue. It is common sense. If you take away health care from 23 million people, many of whom are dealing with life-threatening diseases, what's going to happen? People will die by the thousands. And I say this, I say this with pain, with anxiety. Thousands. There are estimates that if 23 million Americans are thrown off of health care, that 28,000 people could die as a result of that. In the wealthiest country in the history of the world, we must not allow that to happen. Now, what happens when you cut Medicaid, as the Republicans are proposing to do, by over $800 billion through a 10-year period? Well, think about it. What it means is if you are a child with a severe disability, you will no longer get the health care you need to adequately function. An estimated 11 million children, or 15% of all kids in the United States, have special health care needs. They may have conditions such as Down syndrome, cerebral palsy, muscular dystrophy, or autism. They may have mental health care needs such as depression or anxiety or complications from premature birth. Today, Medicaid and CHIP, the Children's Health Insurance Program, cover 5 million kids, or 44% of those children, providing them with coverage so that many of them can live with dignity and security. If Medicaid is cut, is slashed, children with special health care needs could be left to fend for themselves. And I want you to think about it. Children who have serious health problems today could be forced to fend for themselves. Nearly 75% of kids with special health care needs live in low or middle income families. What happens to these kids and their families? And it's not only the children. Think about it. You have a kid with a severe disability who's now getting help from Medicaid, is now in school, doing well. They take that away, that kid comes home. How do you go to work? You don't. You're gonna have to stay home with your kid, which means less income is coming into an already struggling family. What happens to that entire family? Maybe my Republican colleagues might want to think about that for a moment. But it's not just children who will suffer if this bill is passed. It is senior citizens, it is the elderly. What every person in Ohio should understand is that Medicaid now pays for over 2/3 of all nursing home care. 2/3 of all nursing home care. If that is slashed, what happens to the seniors and the disabled who are currently in nursing homes? How many of them are simply going to be thrown out of those nursing homes? Where do they go? How many of them will then come back to their kids, their sons and their daughters who are already struggling economically, who may want to send their kids to college and will have to make the choice because of these cuts in Medicaid as whether or not they send their kids to college or they adequately take care of their parents? In the United States of America, we should not have to make those choices. But But it is not just nursing home care that will be severely impacted. Remember, Medicaid pays 2/3 of Medicaid costs. But it's not just that. Today in Ohio, if you are an older worker, you're 62 years of age, and you make about $42,000 a year, your premiums are going to skyrocket, going to get much, much higher as a result of this disastrous legislation. Trump said he was going to stand up for working people, forcing older workers to pay almost double for their health care premiums is not standing up for the working class of this country. But again, I say to Senator Portman and I say to all of you, it's not just Bernie Sanders' opinion. I want you to hear what the AARP, the largest senior group in America, says. This is what the AARP says, and I quote, "This new Senate bill was crafted in secrecy behind closed doors without a single hearing or open debate, and it shows. The Senate bill would hit millions of Americans with higher costs and result in less coverage for them. AARP is adamantly opposed to the age tax, which would allow insurance companies to charge older Americans 5 times more for coverage than everyone else, while reducing tax credits that help make insurance more affordable. As we did with all 435 members of the House, AARP will also hold all 100 senators accountable for their votes on this harmful piece of legislation." So what AARP is saying, which is absolutely true, is you got older workers, 60, 63, 64. Many of these older workers have almost no savings in the bank as they prepare for retirement. They got nothing. And now what Trump and the Republican leadership want to do is to almost double the premiums for them. That is not the way we treat people in this country. In this nation, 1.7 million veterans have health care coverage through Medicaid. In my view, when people have put their lives on the line to defend us, we have got to treat them with respect. And that means we do not take away Medicaid coverage for hundreds of thousands of veterans. All of you know, and this is a subject for a whole long discussion unto itself, you understand that from coast to coast, including my state of Vermont, we are facing a horrendous opioid epidemic. Every day people are dying. Every day people are becoming addicted to painkillers. They're becoming addicted to heroin. Our job as a nation is to come up with a comprehensive plan of treatment and prevention to stop this epidemic, which is taking lives every single day. Our job is not to cut Medicaid, which provides substantial treatment and benefits for people who are addicted. You know, brothers and sisters, you know, when you turn on the TV and you hear spokespeople from the Republican Party, they love to talk about choice. They're big into choice. They want you to have your choice of whatever insurance company you want, whatever school you want, whatever this you want, whatever that you want. They're all for choice, except when it comes to women's health. what they are telling 2.5 million women in this country who have chosen Planned Parenthood as where they want to get their health care, they may not have that choice. So I say to the President and the Republican leadership, if you believe in choice, let the women of this country make their own choices. And as you know, outrageously, this legislation, the one in the House, the one proposed in the Senate, would defund Planned Parenthood. Now, I receive a whole lot of letters from folks in Vermont, emails from Vermonters and people all over the country. Let me just humanize what we're talking about here. We're not just talking about abstractions, 23 million, what does that mean? We're talking about the lives of human beings who today are fearful and are very, very worried about the future. Here are just a few of the letters that I have received recently. I received a letter from a mother, and she writes, and I quote, "My adult son has Down syndrome. He can barely get by with what few Medicaid services are available now. Please don't punish my son for needing these services," end of quote. Another father writes, quote, "Trumpcare will allow insurance companies to deny health insurance to people with pre-existing conditions. In my family, this could disqualify my son born with a defective heart valve who must have costly open heart transplant surgery to get a new valve every 10 to 14 years. Another letter. Again, we get a zillion of these letters all of the time. Quote, "I am 38. I am well educated and I had a great job, but I developed chronic migraine. I am so disabled I can no longer work. I just qualified for Medicaid. It will be my lifeline as I fight daily pain and other debilitating symptoms. If the bill passes, I fear that it will become a choice between draining my family's financial resources, even facing bankruptcy, so that I can continue to access the limited medical treatments I have that help my condition." All right, that's a gentleman who has severe migraine. Here's something from a psychologist. He writes, quote, "Most of my patients, many of them dealing with the experiences of autism, trauma, eating disorders, and/or anxiety, can only receive services because they are covered by health insurance. This disastrous bill could allow insurance companies to deny coverage for mental health diagnoses, making it very difficult for the bulk of my patients to access services," end of quote. Brothers and sisters, what we are talking about here is not just health care. We are talking about what kind of country we are and what kind of nation we want to be. At the very deepest level, we are talking about the moral values of this country. And the good news, and it is very clear, I don't think there is much of a debate on this, and this is one of the reasons why Leader McConnell tried to push this thing through without any hearings. The American people, in poll after poll, indicate they are widely opposed to this legislation. According to the latest NBC News Wall Street Journal poll, just 16% of the American people believe that this legislation is a good idea. And here's also the important point, and why the Republicans, in an unprecedented way, this is extraordinary. When you deal with health care, you're obviously dealing with an issue that impacts every person in this room, every person in America. It deals with 1/6 of the economy of the United States of America. You would think that the Republicans would want serious discussion and debate. They would be proud of their bill. They want to bring their bill to the American people and explain what they are doing. I am a member of the Health, Education, and Labor Committee, the committee that deals with this issue. There has not been one hearing on this issue. We have not heard from doctors or patients or hospitals or insurance companies as to what this legislation would do. How can you pass a bill that impacts every American and 1/6 of our economy and not have one hearing? And the reason is, what they want to do is pass this bill with as little discussion as possible so the American people do not know what is in this terrible legislation. So I say to my Republican colleagues and Leader McConnell, if you're so proud of this legislation, take it to the floor, let us debate it. Let us hear whether the American people think it's a great idea to raise premiums for seniors, to throw 23 million people off health insurance, and give huge tax breaks to billionaires. If you're proud of that idea, take it to the American people. Let's debate it. But what you should know is those people, those stakeholders, those folks who deal with health care every single day, virtually every major organization in this country is vigorously opposed to this Republican bill. He mentioned the AARP, the largest senior group, other senior groups as well. The American Hospital Association opposed. The American Medical Association, conservative group of doctors, opposed to this legislation. The American Cancer Society, the American Heart Association, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Psychiatric Association, and on and on and on. Those people who understand the problems we have in healthcare today understand that our job is to improve Obamacare, not destroy it. All of you know, and Ohio knows it maybe better than most states, what has been going on in this country over the last 40 years. And what we have seen, tragically, is a middle class in decline, people working longer hours for low wages, people losing good-paying jobs, getting jobs that pay half or two-thirds what their previous job paid. We're seeing 43 million people living in poverty. We're seeing kids leave school $50,000, $100,000 in debt. We're seeing moms not being able to afford child care for their kids. We are seeing in America a situation where while the middle class shrinks, we have the most unequal distribution of income and wealth of any major country on earth. Today in America, if you can believe it, top 1% now owns almost as much wealth as the bottom 90%. Today in America, 52% of all new income being generated. You're working 2 or 3 jobs, 52% of all new income is going to the top 1%. In the midst of this moment, when the very rich are getting richer while the working class is struggling, now is not the time to cut the health care benefits that working people need and give tax breaks. You don't attack the working class and give tax breaks to billionaires when the rich are already doing phenomenally well. Let me conclude by just saying this. A great nation, and I believe we are a great nation, is not judged by the number of billionaires it has, by the number of millionaires it has, by the kind of tax breaks we give to the people on top. A great nation is a nation judged by its compassion about a great nation is judged by how we treat those who are sick, those who are disabled, those who are old, those who are young, the little children. This bill is a moral outrage. This bill is immoral. This bill is not what we as Americans stand for. This bill must be defeated. Thank you all very much.